Good evening, everyone. Like most of you have listened to what Professor Gaurav sir had to say about the department. So I'll introduce the concept of academic surgical practice. And before we go into what is academic surgical practice, in 1960s itself, many academic surgeons felt they need to have an association for academic surgery, and the AAS mission was started to inspire and develop the young academic surgeons. The core values being scholarship, leadership, mentorship, innovation, inclusion, and community of academic surgeons. I'm not going into the details of academic surgery association, but it was founded way back in 1966. As of now, as of yesterday, they have now 10,000 members, and there are a lot of grants, and every year there is a academic association surgery conference in each one in a different country, and they encourage young faculty to attend. And coming to the most important attribute of an academic surgeon is to pass on the knowledge what you have gained to the next generation, as emphasized by Toad et al. So I have been given this concept of introducing or invited three stalwarts in their field. So I will take a minute, say a small story, short story, make you all happy, then I'll introduce. Professor VK Kapoor sir doesn't need any introduction. He is the ex-professor and HOD of surgical gastroenterology, SGPGMS, and now the pro-vice chancellor of Mahatma Gandhi University, Jaipur. And we had invited sir for our ISOPS conference in 2018, and he had given a talk on the art of scientific communication, how to present actually, and it was attended by 200 surgeons from worldwide. And at the end of the thing, when many of the young surgeons requested for his presentation, he forwarded me the PowerPoint, and he told, like, you can forward to as many surgeons, as many people they want. And I have listened to him as a, not even a medico, as a 10th standard student or 8th standard student, with going with my father to surgical gastro conferences. And I request sir now to give a talk on how to attract and retain talent in academic surgery. Over to you, sir.
Dr. Sanjay Bihari, Dr. Biju Potakat, Dean, Dr. Shalin Kumar, Head of the Department, Dr. Gaurav Agrawal, current and former faculty, residents, nurses, and staff of Department of Endocrine Surgery, invited guests from other institutions in the city, faculty colleagues, former faculty colleagues from various departments of the institute, ladies and gentlemen. It's a very nostalgic moment for me, because this is my first formal revisit to the institution. Thank you very much. I'm sure when Dr. Gaurav and his team thought of giving this topic to me, they also might have seen one of these news items. These are very disturbing news. If this is what is happening in the premier institutions of the country, what would be the state of affairs in the state medical colleges? Because these are all central government institutions. I am reminded of a day when a faculty colleague from a state medical college, Department of Surgery, was attending our annual CME activity, the Surgical Gastroenterology Week. And during the dinner, he told me that, sir, it was very difficult for me to get the permission to come because we are only 2 faculty members in the Department of Surgery. And this was a department which had, at that time, if I remember correctly, 100 or 150 MBBS students and maybe about 8 to 10 MS students every year, and only 2 faculty members who are not only looking after patients, but are responsible for teaching and training them also. And over the years, the problem seems to be increasing. So I think it's very appropriate that the Department of Endocrine Surgery thought of talking about academic surgery and asked me to talk on how to attract and then how to retain talent in academic departments. There's no literature on this. There's no evidence. So I can't make any recommendations. There is a disclaimer. Whatever I'm going to say are my personal views and my personal thoughts. Of course, the audience doesn't include doctors, but why surgery? Why not any other specialty? The other specialists, please excuse me, but a surgeon definitely does more. A surgeon is a physician who does something more. And that is why it was called surgical strike. It was not called medical strike. Why not surgery? Because obviously you have to work more. I always tell my residents, don't crib about working hours. Because in surgery, work is food. If you want to be healthy, if you want to get more food, you have to work more. So those who are not willing for this kind of a lifestyle may not opt for surgery. Which surgery? I had this dilemma when I knew from first year MBBS, because I liked anatomy very much, that I'm going to be a surgeon. But after finishing my MS, I was not sure which branch of surgery I would take. Cardiac surgery was very glamorous, but unfortunately, I had a political tiff with the then head of cardiac surgery at AIIMS, Dr. Venugopal. So neither I wanted to go there, nor he wanted me to come to his department. I like pediatric surgery because it was very broad spectrum like general surgery. And in fact, I did go because at that time in AIIMS, there was no seat in MCH pediatric surgery in that session. So I went to PGI Chandigarh, but was on the wait list. I was selected for neurosurgery. Sanjay, please excuse me. But I didn't join because I thought it's a very morbid branch. And I left it just a day before the last date of joining. And till date, all neurosurgery seniors of All India Institute, they are very unhappy with me. But because of that, they remember me also, that I was selected but did not join. Urology, I hope there's no urologist in the audience. I didn't like the smell. And plastic and oncology were not options at that time in AIIMS because these departments were not there. But I was fortunate that I worked with a mentor named Dr. T.K. Chattopadhyay, who was in general surgery, but he used to do a lot of GI surgery. And because of his mentorship, I had clinical surgical experience as well as a couple of publications in GI surgery, and that is why I was selected here. I'm not an MCH in GI surgery. There was no MCH at that time, but I'm fortunate that I've trained more than 100 MCH students so far. So what attracts talent to an institution? It is the first thing is the institute. First thing which anybody would say that where are you joining? And it is the rank, the reputation of the institute. And of course, today, when we got into medicine, remuneration probably was the last consideration. But today, since life has changed, it has become a little more materialistic. Remuneration is important, and that is where the central institutions score over state government institutions, if we talk only of salary and not the unallowed private practice. Next is the department. So if I have a choice of 3 or 4 institutions, I would like to know the reputation of the department. And let me tell all faculty colleagues who are heads or going to be heads of the departments that the reputation of the department is built by your students. They are the ambassadors. You may be doing anything, you may be having any number of publications, but if your student goes out and says that this department is not good, nobody is going to join that department. So you have to look after your residents. You have to keep in touch with them so that they say good things about your department when they go out of the department. And yes, the head of the department, the charisma of the department, the overall impression about the head of the department who's going to be there for next couple of years is also important. Also, I would like to say, and this is more important in the institution where I'm working, I keep telling my faculty there that clinical work will give you name and reputation in the city, maximum in the state. If you want national recognition, you have to go to society meetings and make presentations there. And of course, international reputation comes from publications, as Gaurav has said, that endocrine surgery, we all used to consider endocrine surgery as a small department, as a half department, but they probably have more publications than many other departments in this institution. And I'm very happy. And with those number of citations, it's no surprise that Gaurav lists in top 2% surgeons and scientists of the world. Now, the dean is sitting here. I'm sure some of you would become the directors tomorrow, either in this institution or in another institution. This institution has provided so many directors and principals to so many institutions in the country. How to select? In my opinion, selection should be proactive. It should not be a passive selection that you advertise and then you take. No. Advertisements are the means of selection, but they should not be the only source of appointment. The directors, the heads, the deans have to have a networking. You have to keep telling your peers in other institutions, the heads of the departments, that tell me if you have a good student who's passing in the next 1 or 2 years. Keep an eye on them. Look for them in society meetings, in conferences, in publications. And a concept which I tried, but I would request to the dean that we should have this, that suppose there is a student who has passed the requisite qualification, has the requisite qualification, allow him or her to spend a month, 2 months, or 3 months here. Get to know the department, get to know the institution, the department gets to know the person, and then select that person. So I would say that rather than advertise and select, make it identify and then advertise. You have a person in mind, and then I may be saying things which probably a bureaucrat may not like, but that is the way to build departments. So few sentences which I have borrowed or tried to modify some other things, that ads do offer jobs, but talent is not looking for a job. Talent is looking for an opportunity. Give that opportunity to the talent. And let me tell you, there are more good students floating around frustrated because they are not getting an opportunity than there are good institutions. So don't say that there are no good candidates available. We have to look for them. And ultimately, a department or institution becomes what it hires. Whom to select? In my opinion, it is, yes, merit is important. Merit is the prime factor, but not alone. Obviously, again, something which now I can say because I'm retired, I'm not a government employee. It's not domicile. It's not recommendation. Don't select somebody because somebody wants that person to be selected. I would say that for surgery, especially, skill is important, but aptitude is more important. Skill you can give. Skill you can impart. Aptitude you cannot. Attitude you cannot. And that is where apprenticeship becomes important, because unless you know the person, unless the person has been exposed to you, you would not know what his or her qualities or bad qualities are. And personally, I'm willing to take a person who's above average, but is a team member rather than an excellent individual player. I mean, surgery, or for that matter, any branch of medicine, an academic institution is not a game of chess where one person is important. It's hockey, it's cricket, it's football. The whole team is important. And that is why I personally, and I will exemplify that a little later, am willing to take an above average or a good person rather than an excellent person, provided the other qualities are there. So a swan looks very beautiful, but I searched and I found that they are not very friendly to their peers, to their counterparts. And that is one quality which I do not want in any faculty member, in any department, in any institution. So I would like to give example because, as I said, there is no literature, there is no evidence. So I would talk from personal experience, from departmental experience, the Department of Surgical Gastroenterology. I remember this is way back in 1989. He's my younger colleague. Some of the faculty colleagues would know him. He was a senior resident in All India Institute of Medical Sciences, was still undergoing senior residency. But on my suggestion, on my advice, he resigned and joined here as a senior resident. That was the move to make him an apprentice here. I told him that if you appear in the interview as an unknown person versus if you are working here and then appear in an interview, it will make a difference. And during his stay here as a senior resident, he could impress upon late Dr. Kaushik and late Dr. Nayak of his capabilities, and there was no problem in his getting selected. Richa was even younger than me. She was again in All India Institute, an accomplished pediatric surgeon. Since she was about 10 years younger than me, I didn't know much about her. I knew that she's there, but her mentor, Dr. Vireshwar Bhatnagar, who was the head of the department at that time, spoke to me, and we were looking to expand our pediatric surgery component. And I still remember 3 distinguished, very senior surgical gastroenterologists of the country. They were experts in that interview because the interview was for the professor's post also. The moment she walked out of the room after the interview, they told the then director, Dr. Pandari, this is the material you are looking for. And then Anu, of course, Anu had been with us as a senior resident, as a pool officer, and she had worked with me. I knew that there is no other compassionate, scientific, ethical surgeon than Anu, which I can find. So I knew that she will be the conscience keeper of the department. She would not do anything wrong. She would not let any one of us do any wrong. And then again, I looked towards the All India Institute because my contemporary was the head of the department there, Dr. Piyush Sani, that who are your pass outs? And he recommended 3 names. Dr. Sujoy Paul came to us on an ad hoc vacancy. With great difficulty, I could arrange for an ad hoc vacancy, but for family reasons, he had to go back. There was another friend of his, Saurabh Kapoor, but he was bound to US, so he didn't. But Rajneesh finally agreed and joined. And now, as you all know, Anu is heading the department, taking the department to new heights. And Rajneesh, in addition to his surgical skills, he's an excellent surgeon, is looking after administration. He's also looking after the Indian Association of Surgical Gastroenterology. Whether we agree or not, there are certain laws, there are certain government rules. In all appointments, we have to take people from different groups. And that becomes a problem. I know that the institute has run into problems in that. But there also, you have to keep looking for the best available material in that group. And I knew that Anand, after finishing his senior residency with us, has gone to one of the leading minimal invasive surgeons, Dr. Palani Velu in down south, and has got trained in minimal invasive surgery. So we fulfilled both needs. We could satisfy the fact that we had to take a person from a certain group, and he could develop minimal invasive surgery. The department, unfortunately, he left the department recently, but I'm sure he's doing very well in the corporate sector. Ashok, Younger, and Supriya, they were not selected in my regime, but for various reasons, departmental adjustment, Ashok was transferred to us. And I still remember I and Anu both discussed, and we said that he is raw, he's not very mature, but we knew that he is a simple person. And we were very happy when he joined us because the biggest quality in him was that he knew his limits. He knew how much he could do and when he needed our help. And we were there to help him. Also, we groomed him. All major cases, both I and Anu would ask him to start. And then gradually he improved, and I know that he has become a very skilled surgeon today. A few words for the heads of the departments. Once you become the head of the department, there is no competition, no jealousy, no envy, no revenge. No dekh lunga. Don't use younger faculty and residents as pawns. That is what destroys a department. Let the team do. You sit, relax, enjoy, have a cup of tea, read books, but take the credit. The best example of this I'll give was Dr. Nayak. Create a second line. I very much dislike people who excel in a job, but once they leave, there is a vacuum. That should not happen in an academic institution. And the attempt should be that the next generation should be doing better than you. And when you leave, you should leave a mark. Saas bhi kabhi bahu thi. So two examples I'll give. Neurosurgery department, Sanjay knows it very well, has a tradition. I don't know whether it is continuing or not. The senior most person never was the head of the department. It was the second person who was the head. And it never created a problem. And of course, I'm sure there are many other exemplary heads, but these are the two people with whom I worked. As I said, Dr. Nayak, he was not an expert in endoscopic interventions. He never did ERCPs. It was Dr. Chaudhary and Dr. Saraswat who did. But he let them do. He let them grow. The department was known for excellence in ERCP. So when he goes out as head of the department, he gets the credit. Dr. Kaushik, I remember, we met in ASICON in Varanasi, both I and Dr. Rajan Saxena, and we knew that he has been selected and he's going to join. And when we went to him, he said, Vinay, Rajan, I have played my innings, tum log batting karo. And that is what he did. But the department was known by his name. The director is not here, but the dean is here. And as I said, some of the future directors are here. Easy to say, but difficult to do because we've already gone down on that. Do not lose the autonomy of the institution. That the letter still says that we are an autonomous institution, but it should be in practice also. Whatever happens in the institute should be what the director wants, nobody else. Administrative ethics are also very important. I know that it is a difficult job. I have never sat on that chair, but I know it's a difficult job. You cannot make everyone happy. You cannot satisfy everyone, but ethics are not to satisfy everyone. Ethics are what you think, what your conscience thinks is right. And ultimately, what you are doing is good for the institution. It may not be good for some individuals, but it should be good for the institution. Lines of communication should be open. The directors, the deans should keep communicating with the heads should keep communicating with the faculty should, of course, keep communicating with students, not only for teaching, but otherwise also. The true mentor-mentee relationship. The directors should be liberal as far as possible within rules. You should not be restrictive, and obviously you should be fair and just, but do no harm. The same principle as applies to medicine applies to administrative positions also. You may admonish, you may punish, but don't do harm to individuals. And I know that there are examples where harm has been done to individuals, not in this institution only, but everywhere. So I totally disagree when the new directors of AIIMS are called chief, executive director or something like that. That is wrong. That we should have resisted. They are directors, they are the owners, they are the parents or the father of or mother of that institution. And by giving that nomenclature, the government has taken away a major part of the authority of the directors. One thing which I learned when I was preparing for this presentation is a term called onboarding. This is a corporate term. When a new employee joins, there is a welcome, there is an introduction, there is an orientation. The whole team makes efforts to involve that person. That unfortunately doesn't happen in our institutions. There's no formal welcome of the new faculty. The faculty member comes, he starts working in the OPD the next day. If he has come from another institution, how would he feel? वो बहू वाली फीलिंग आएगी कि ससुराल में आ गए और अगले दिन रसोई में लगा दिया. There has to be, and once the faculty member is there, at least as an assistant and associate professor, at every stage, the faculty member should feel encouraged, motivated, and each and every contribution of the young faculty should be acknowledged, appreciated, and recognized, both by heads and by the directors. Last is how to retain. We know that in government institutions, we can't increase the salary because we are bound by the government rules. But academic perks and incentives can be increased. That is where autonomy comes. That is where budgetary planning comes. No, you frame the budget in such a way that you say that we are giving the same salary as this secretary or additional secretary, but we are giving perks. All public sector undertakings, you look at their emoluments or remuneration, salary is this much, perks are this much. If they have been able to do it, why can't we do it for our faculty? It could be extra conferences, it could be incentives for publications, it could be sabbatical leave. I have been asking, and I had been saying this, but I couldn't get it done. Any faculty member who has served for 10 years should be given an option for 2 years to go anywhere. You go anywhere, you have your job, make money and come back. Agreed that only 8 out of 10 will come back, but 8 will come back economically, financially satisfied. It serves two purposes. They are not bothered at home कि मेरे बच्चे की पढ़ाई कैसे होगी. They concentrate on work. And if at all finance is the reason for corruption, that will be reduced. Personal recommendations. All directors, all heads of the department should be on the lookout for opportunities where you recommend your younger colleagues for a scholarship, for a fellowship, for a sabbatical, for training, or whatever it is, for speaker, for writing chapters and all. And that is how you retain the younger faculty. Few words. I don't know if any younger faculty colleagues are here. Assistant and associate professors are here to learn. You should be hungry. You should have a very high appetite, although in endocrinology words that may indicate a hormonal disorder, but it is okay for assistant as associate. Once you become associate or additional, then you fill your tummy. You do as much as you can. But the moment you become senior, additional and professor, then your job in a teaching institution is not to do. It is to train, to guide and supervise. Then you feed others, the younger faculty colleagues. That is how things work in an academic institution. Joining an academic institution is a marriage. I won't use other words, but joining a corporate hospital is a different ball game altogether. But if you have joined an academic institution, it's a marriage. You are committed to it. You are dedicated to it, both to the department and to the institution. No extramarital affairs. All faculty members should give more than you receive. Don't grudge. कि मैं तो इतना काम करता हूं, मुझे कुछ नहीं मिला. That is what is expected. You have to give more to the department, more to the institution than you expect from them. And of course, it applies everywhere, but more so in an academic institution. Ethical, moral, academic, and financial integrity is the basic prerequisite. In our times, this term was not there, but today work-life balance is important. We all, people of my generation today, regret that we ignored our parents, our spouses, our children, our families, our social life, our personal life. I don't know whether that was right or wrong, but today, obviously, work-life balance is important. So spare some time for this also. Some of the colleagues here would know. I can talk about it because now both of us has retired, both me and Dr. Rajan Saxena from this institution. So all these things are immaterial now. We had a long administrative and legal tiff. But I must give 51% credit to Dr. Rajan Saxena that we did not allow that to percolate down to the faculty or the residents. It did not affect our professional or social relations. We are still same friends as we were when we joined this institute 30 years ago. Another example, how to stay on. And in fact, this was more like a race because both of us were trying to stay ahead of each other and both of us were running fast. Dr. Ashok, the senior, had problems with the institution, with the department, with individuals, but he persevered. He knew that both I and Dr. Rajan were interested in hepatobiliary surgery, and since he was younger, he could not catch up with us. But he took a very wise decision. He moved to colorectal, which was not a glamorous area, which was not an area of interest. And I must say that he made a mark. He became a renowned colorectal specialist. He went on to become the secretary and president of the Indian Colorectal Society, received several international awards, fellowships, and all. So find your area, find an area which others are not interested in, and then excel in that. And that is what created a department. That is what created a department which was not only the largest in the country, but it, for a long time, it was the most sought after department by the students. See, patients will go anywhere, wherever facilities, experts are there. The value of a department is what the students who want to join that course feel. And I can say with pride that we were always in top three, AIMS, GB Pant and us. Sometimes we were number one, sometimes we were number two. Now Biju is catching up. So I'm very happy to see that he has established an excellent department of surgical gastroenterology at Jaipur, Pondicherry. And that was because the institute, the department attracted talent other than me in the department. And we were one of the few departments where attrition rate was very, very small as compared to many other departments. And that is because we all work together as a team. Now, you might ask, those of you who know, that I left early. I left before my term came to an end. Why did I? The reason was that, of course, this was only 2 or 3 years before my term was to end. The reason was that I was finding that I have kind of reached a plateau. I was not doing anything more. I was not doing anything worth. And therefore, I moved to a teaching institution. And in North India, I could find a good teaching institution where one of my former students had already started the department, but they were waiting for me to start a new MCH course in surgical gastroenterology and HPB surgery. And for the last 1 year, because it's a medical university where there are 7 colleges, dental, nursing, occupational physiotherapy, hospital administration, health informatics, I have been given the responsibility of being the pro-vice chancellor, where now I am trying to mentor more than 500 faculty members in that university. But I'm still available to the younger faculty colleagues of my parent institution. These are my contact details. Please feel free to contact me. So taking advantage of my age and considering the fact that they were all at some time or the other my students, thank you, Shaleen. Thank you, Gaurav. Thank you, Anjali. Thank you.